Welcome back. First Alert Safety Desk now. You're urged to check your measles vaccination status. Health officials are investigating 2 confirmed cases. Aisha, what are you learning this morning?
Well, Tammy, state health officials, the department, along with Lafayette County Health Department in southwest Wisconsin and Iowa County near Madison, are investigating these 2 new cases. These are the 3rd and 4th cases of measles confirmed in our state so far in 2026. Health officials say they're not related to the first 2. These cases are believed to have been exposed in Wisconsin, at least those people, which means there might be other people who are sick. Wisconsin DHS says not everyone who gets sick seeks medical care or is tested for measles. Health officials say they're working to identify and notify people who may have been exposed to the virus. If they identify a public location where people may have been exposed, the plan is to make that information public. But again, DHS says it's important to check on your vaccination status. Measles is very contagious. It can cause serious health complications, including pneumonia, brain damage, and deafness. It can even sometimes be deadly. DHS says 1 in 4 people who get measles in the U.S. will be hospitalized. Some of those symptoms typically appear about 10 to 21 days after someone is exposed to the virus. Runny nose, high fever, that notorious red rash with raised bumps, watery eyes. Anyone who gets it is urged to stay home from work or school. You can also check the Wisconsin Immunization Registry or call your doctor to see if your child or yourself have been vaccinated.